came to us like many other patients. She had her initial endoscopy at an outside medical facility.
I was initially delayed by the first recommendation for a doctor. I struggled getting into a gastroenterologist, getting some exams, and when I finally did, and they identified it as cancer, I was really struggling trying to get even a phone call back. And my husband and I decided to cast a wider net. It's okay to keep looking, and it's okay to be your own advocate and push for the best care that you can for yourself.
It is an honor for me to be the first contact for patients like Mandy, and I try to just meet patients where they're at and listen. I think it's incredibly important to be straightforward with what we're dealing with, but also give them hope that we here at the University of Colorado Cancer Center have a lot of innovative treatments that we can offer, and we will be here for you at every step of the way.
Within one day, I had an appointment set up with a multidisciplinary clinic and was going to meet all the doctors, and within a month of that, started treatment.
Here at University of Colorado Hospital, we bring together all the different specialists that are involved in treating esophageal cancer. By being in the same room together, we're able to really discuss things real time as a group, bounce things off of each other, and then the patient is actually seen in clinic that same day to meet with all of those providers in a single visit and go over their treatment plan.
That first meeting when you come in and they run through and you meet all of these people, I'm like, there's a lot of great minds and great talent working for my case.
As part of our multidisciplinary clinic, patients have the opportunity to participate in one or more clinical trials oftentimes. In the case of Mandy specifically, her tumor was locally advanced. That increased her risk of not having a complete response, of having a recurrence down the road. And so the clinical trial that she participated in used the standard treatment, which was chemoradiation followed by surgery, but actually added 3 rounds of a more intensive systemic chemotherapy called FLOT before starting the chemoradiation.
Based on the location of Mandy's cancer, she needed an esophagectomy. So what that means is she needed the bottom half of her esophagus to be removed and the top portion of the stomach. In the process of removing the top part of the stomach, it essentially turns the stomach into a tube, which becomes then the new bottom half of the esophagus.
Nothing could pass my lips for 7 days, no water, no nothing, but it ensured that the sort of fusion of my esophagus and my stomach worked.
I think what contributed to Mandy's doing as well as she did was her wonderful attitude. That is sometimes a factor that is underplayed, but she was always optimistic. She was willing to recover and to do well.
Hope can be your enemy sometimes because you don't know if you are allowed to have that hope. But I think it's okay, and I think it's good. I really feel blessed to have found the multidisciplinary clinic team, and so I appreciated so much that they were direct and confident, hopeful and kind. I have a lot of gratitude and kind thoughts, so thank you. Thanks, guys.